well. Let's turn to the alert system. We are seeing no counties go purple. That is the one bright spot, and I'll talk about that in a moment. We no longer have a purple. We don't have any purple counties and no counties on our watch list. However, this virus is spreading, as you can see, significantly throughout the state. So we're down now just to two counties, eastern side of our state, that are yellow. Everything else is red or orange, and it just shows the gravity of this spread. Today we have 43 red counties, only 2 yellow counties. This is the highest number of red counties, lowest number of yellow counties we have seen to date. Our new red counties, Ashtabula, Auglaize, Claremont, Defiance, and Trumbull. This is an increase of 5 counties from last week, and 2, Ashtabula and Auglaize, are red for the first time. This week, 78% of Ohioans are living in a red county. 78% of Ohioans are living in a red county. Less than 1%, as I said, are living in a yellow county. Now, let me talk for a moment about the 3 counties that dropped from the watch list to red. Our system is designed to something, if a county goes to purple, it has to continue to accelerate. It has to continue to go up. What we've seen with Cuyahoga, Clark County, and Hamilton basically is that they plateaued or did not see a significant increase, and not a significant enough increase to move to the purple level. But we're still seeing with these counties very, very disturbing trends. As I said, our alert system is designed to flag indicators that are getting worse. What we're seeing is that these 3 counties have plateaued at high levels. In Cuyahoga County, outpatient emergency visits are at an elevated plateau. Hospital admissions have been increasing. Clark County, emergency visits and hospital admissions have plateaued at an elevated level. Outpatient visits are still high. In Hamilton County, outpatient visits and hospital admissions are at an elevated plateau, but cases continue to go up. During the past month, the average age of cases in Cuyahoga County, the age of the individuals in Cuyahoga, Clark, and Hamilton counties has moved from people in their early 40s to people in their late 40s. So we'll continue to see an increase in the age, or the average age. If you recall back in June, July, when we saw that significant increase, that was really led by a younger group. In Cuyahoga and Hamilton counties, cases continue to rise steadily and hospitalizations remain elevated. Clark County local health department officials told us today they're seeing alarming increases. They have recorded 271 cases during the past 7 days, 271 during the past 7 days. Hospitalizations are at a record high, and they've had 41 deaths in Clark County in October. Their previous high for deaths was 17 in August. What we see in these counties is similar to what we're seeing in the rest of the state. Case numbers are continuing to go up. Healthcare utilization is trending upward. We've been sharing stories about where we see spread, and as I talk to the health directors every Monday morning, and they share some stories with me. They also share some stories with our staff. High school football team had 13 players with COVID-19. A couple of the players were infected, spread it to the other members of the team. The spread mainly happened at informal gatherings of the team where there were more interactions than there should have been. These were not regular team functions. So again, this is similar to what we're seeing in the adult world, where it's not as much in, look, there's spread everywhere. But most businesses, we're not seeing much spread. Same way with schools. But where we're really seeing the spread is just the personal interactions, the more informal settings. Another example, we learned about an outbreak among staff at a doctor's office as a result of non-compliance, not wearing masks. Staff members at the doctor's office were either not wearing masks or were not wearing them correctly. Finally, we learned about a funeral at the end of September that now has 19 cases, 19 individuals who have COVID associated with that funeral. 17 of the cases were identified with the funeral and 2 cases were secondary spread. One of the points we discussed on our call in Holmes County this morning was that most things we can do. Fran and I have been to 3 funerals that were safe. Certainly, as far as we could observe, everything was done right. Weddings can occur. Many things we can continue to do, but it's just how we go about it that we have to be careful about.